Hey, good morning, everyone. I'm going to go ahead and call the meeting to order. We are just a few minutes late, 3 minutes late. So, we've got a full house today. I'm really excited that we've got such good participation in today's meeting. My name is Chris Goff, and I serve as the chair of the Indiana Justice Reinvestment Advisory Council. As a reminder, this meeting is being live streamed, and please ensure that when you are speaking, that you are talking directly into the microphone. Also, we do have a member who's participating remotely, and so because of that, we are required to take roll call votes for all action items as we have members or proxies attending today's meeting virtually. The first item up for business is the approval of our meeting minutes from June 27th, 2025. Before I call for approval of the minutes, we have just so many new members. We have some proxies who are here today, so if I could just take a moment and ask everyone to introduce themselves and indicate the agency or entity that you're here on behalf of. Steve, can I ask for you to start us off, please?
Sure. Steve McCaffrey, and I am the President and CEO of Mental Health America of Indiana.
Thank you.
Hi. Good morning, everyone. Zoe Fran, CEO and President of the Indiana Council of Community Mental Health Centers, representing all 24 community mental health centers and others on state and federal policy.
I'm Angela Morris. I'm the probation officer, Popeye representative. During the day, I work in Johnson County as the court services director.
Good morning, I'm Kelly Bittar, President of IACAC and Director of Lake County Community Corrections.
My name is Daniel Glass. I'm the Division Director for Public Safety and Business Affairs at the State Budget Agency.
Good morning, I'm Chris Naylor, Executive Director with the Indiana Prosecuting Attorneys Council.
Mark Spitzer, President of Indiana Judges Association and Judge of Grant Circuit Court.
Doug Hunsinger from the Indiana Criminal Justice Institute.
Catherine Ploy, I'm Executive Director for the Indiana Office of Court Services, and I'm a guest.
Adam Carter, I'm a state public defender and proxy for Senator Rodney Poole.
Morning, everyone. I'm Jenny Bauer, staff attorney with Court Services, and I'm the official minute taker for the group.
I'm Angie Hensley with the Office of Judicial Administration and heading up the data work group.
Howard Sims for the Division of Mental Health and Addiction, proxy for Director Ms. Sarah Sailors.
Chris Bean, I'm the Director of the Justice Services Division at the Indiana Office of Court Services.
Brett Clark, State Senate, here proxy for Senator Aaron Freeman, the Chairman of the Criminal Law and Corrections Committee.
Marilyn Travis, Legislative Assistant, Senator Freeman, Senator Clark, and I'm a guest.
Chris Blessinger, Deputy Commissioner for Department of Correction, and I'm designee for Commissioner Arnold.
Liz Darledge, also from the Department of Correction. I am a guest.
Hi, good morning. Becky Buhner. I'm the Deputy Director, Chief of Staff at the Division of Mental Health and Addiction.
Derek Mason, the Executive Director for the Commission on Court-Appointed Attorneys.
David Bodorf, Executive Director of the Association of Indiana Counties.
I'm Michelle Goodman, staff with the Indiana Office of Court Services. I provide staff support to JRAC in a couple of capacities.
I'm Mitch Gore, here in my capacity as the ranking member of House Courts and Criminal Code.
Okay, thank you, Representative Gore. And joining us remotely, we do have Bernice Carter and Denise Simden. Can I ask both of you to just introduce yourselves as well, please?
Sure, I'm Denise Simden with the Center for Effective Public Policy. Our organization is the one that is providing technical assistance to a number of your JRAC teams.
I'm not sure Bernice can hear us.
Thank you. It looks like, thank you, Denise. And Bernice, I think maybe you're having some audio difficulties, can't hear. Bernice is here. She's the Executive Director of the Indiana Public Defender Council. She wasn't able to join us in person today, but we appreciate her dedicated partnership and her ability to join us remotely today. This group represents the leadership of several important agencies and organizations that help support our communities as they provide public safety and treatment resources to our county justice systems. We are being live streamed today, so we welcome all those members of the public that are viewing our meeting. Would also remind all the members that everything that you're saying is being live cast, so hot mics, and hopefully we'll have an opportunity for some discussion at the end of the meeting. But turning back to the agenda, prior to coming together this morning, the staff here at the Office of Judicial Administration distributed members of the proposed minutes from our June 27th, 2025 meeting to everyone. If you've had the opportunity to review those proposed minutes and there are no changes or corrections, I would entertain a motion to approve the minutes.
So moved.
Thank you, Doug. There is a motion to approve. Is there a second?
Second.
Thank you, Kelly. So there's a motion and a second to approve the proposed minutes. Is there any further discussion? Very well. I will then call for the roll vote. Bernice, are you able to hear me now? Not hearing her, so I'm, Steve asked for your vote.
Aye.
Approved. Zoe?
Aye.
Angela?
Aye.
Kelly?
Aye.
Daniel?
Aye.
Chris?
Yes.
Judge?
Yes.
Doug?
Aye.
Adam?
Aye.
Aye. Chris? Oh, Howard, I'm sorry.
Yes.
Chris?
Aye.
Senator?
Yes.
Okay. And Chris? Okay. Becky? Derek?
Yes.
David?
Yes.
And Representative?
Yes.
Okay.
I think maybe we're gonna ask her in writing. Are they gonna?
I'm working on it.
All right. Well, and just for purposes of moving the meeting along, unless council tells me otherwise, I think that we've got unanimous approval, and Bernice is having some technical difficulties, so we do have sufficient votes to approve the minutes, so we'll move along with the agenda. And the next item on our agenda is report outs from our work groups. And so for the first report out, I'm going to turn the floor over to Chris Bean to give a report on the work that's been completed by the local JRAC work group. Good morning, Chris.
Good morning, Justice Goff. Thank you. And Denise she's also here to help provide, as she is with CEPP, providing the technical assistance.
Been invaluable.
Yes, absolutely. So CEPP is currently working with 21 of our counties. Union, Franklin, Monroe, Lawrence, Floyd, Lake, Jasper, Hamilton, White, Tipton, Johnson, Tippecanoe, Miami, Rush, the state JRAC team, Martin, Elkhart, St. Joe, Scott, Whitley, Newton, and Clay. CEPP is also engaged in and completed work in 20 other counties. So we're sort of getting to that sort of critical mass where it's potential we have a good tipping point with the state JRACs that are providing enough or ample local support so that these JRACs can really get up and functioning the way that JRAC was sort of intended to be doing locally. CEPP is also facilitating ad hoc work with Lake County on data collection. Kelly from Lake County's here. Based on information contained in the 2025 annual report, we always ask if they're interested. We keep sort of a live link on our website or on the JRAC website to request technical assistance. So it's open. There's no opening date and closing date. It remains open at all times. But as part of the survey that goes out annually, we always ask if they are interested in receiving technical assistance. When they say yes or something that isn't a no, I refer them to CEPP to reach out. So Denise and her staff have been doing that. As part of their technical assistance in working with Floyd County, in a couple of weeks, Floyd County is actually hosting sort of a first-time JRAC summit that's sort of regional. CEPP is providing support to that. Justice Goff is going to be delivering the opening remarks. Denise and I are doing a session together. So with that, I will turn it over to Denise if there's any other updates that you have.
Oh, Chris, you did a really nice job, I think, summarizing our activities. We've been quite busy. The other thing I just would add is we have also completed work with about 20 other counties. So we're at around 55 counties that we've made contact with and either have worked directly or have provided some ad hoc support. So our plan is, to continue working with the 21 teams and reaching out to other counties based upon how they completed the annual report from last year, and look forward to the annual reports completed in the coming year. So we'll continue to reach out based upon feedback we get in those annual reports as well.
Just Senator Clark wrote a question down, and it's a great question. The event is actually November 14th. If you are interested in attending, I do know they have limited space. However, Judge Stiller from Floyd County has been interested in allowing individuals from around the state that want to see it, observe it, take part, to register. So if you are interested, let me know. I think Angela, I sent you they were excited to have anybody that wants to come view it. So
I'm sure anybody that wanted to visit the event from the state JRAC, they would be more than thrilled to have you there, so, yeah. Chris and Denise, thank you so much for all of the work that you've done over the past few years and you continue to do to support our local justice systems. Had an opportunity to have a conversation with Daniel Glass this week just about the structure of our court system is such that we don't have a unified justice system in Indiana. We don't have a common budget or administrative structure that ties together all of our different justice systems. And about 10 years ago or so, we went through a process as a state to comprehensively overhaul our justice system. As a result of that, a lot of folks that used to be the responsibility of the Indiana Department of Corrections became the responsibility of local systems to supervise and provide treatment to in order to foster and protect public safety. State JRAC was formed by statute to build consensus around prioritizing things, like make sure that you had enough to provide those essential justice services. A couple years ago, the General Assembly then passed our local JRAC statute, which creates a corresponding body in every county. And so this body really is the way that we can communicate as a state with all of our local justice partners. And so very, very excited that Judge Stiller and her colleagues took it upon themselves to hold this summit. And I would encourage anybody that can come to be present or at least reach out to your local counterparts down in that part of the state and let them know, encourage them to participate in this process, because we really want to hear from our local partners about what they need to keep their communities safe and to make sure that the folks that need treatment opportunities are afforded them. So thank you for indulging me, Chris, but I just wanted to say that these connections are being made much more effective because of the work that you and Denise are doing on a county-by-county basis. We really have different resources in these counties, but by engaging with our local stakeholders, we're able to make some of these essential things work, even in those counties that are really pressed for resources. And that wouldn't be possible without your efforts, so thank you.
Justice Goff, if you don't want to move on, I would like to just talk briefly about what's going to be the 2025 annual report. As you know, I'm starting to put together, or maybe you don't know, I'm starting to put together a survey that will go out to the counties. It's due March 31st of every following year about the previous year's JRAC activities. I want to do this and make it purposeful so that folks like Angela that have a lot on their plates already aren't just filling out another survey with which we do nothing. So last year we did quite a bit about the opioid settlement funds. I got a lot of really good feedback from chief probation officers, other local JRAC folks that appreciated us asking about it, because then they had to go to their JRAC and ask about it, which really prompted some conversation. That's always my intent. So if there is anything that you would like us to ask about on this survey, and it helps prevent some duplication of another survey or something else that you all need to find out or want to find out, by all means, feel free to email me and I will include it in that survey and make sure that you all get the information that you've requested. Doug and I talked prior to this meeting about just working together to ensure that, again, the busy folks that are working locally don't have to duplicate with all the various reports that they're responsible for.
Chris?
Yep.
Chris, Denise, is there anything else that we need to hear from you with respect to the local JRAC work group before we move on to reports?
Not for me, Justice Goff.
All right. Well, thank you again.
I don't have anything else either.
Yeah, thank you. Thanks again, Denise. Well, Angie, can I turn the floor over to you then for a report out on our reports work group?
Yes, but Michelle's signaling.
Michelle.
Oh, I'm sorry. Excuse me.
It's all right. Thank you, Justice Goff. The reports at work group is in a place where they're not meeting routinely. As you recall from the last meeting, they made some recommendations to update some of these typical report templates. That was their last action item from a work group perspective. Now that these things have been approved, it's more staff supporting JRAC and reviewing these reports going forward. We have the Q3 electronic monitoring report already out for local JRACs to respond to. Those due dates are November 29th for the third quarter. We sent out a reminder earlier this week and then subsequently learned that the electronic reporting platform had some technical difficulties. They were resolved yesterday, so everyone will be able to still submit as reminded. As of Wednesday, we had 39 responses out of the 82 that we anticipate. So we're working with those folks. Before you in your materials is Q2 reports. So this is the updated template we approved in June, but this is with the Q2 data that was submitted by all of the locals for your review and approval today, sir. So that's my report.
Well, you are requesting action on approval of the report, Michelle, is that right?
Yes, sir.
Okay. So, thank you, Michelle, for your report, and thank you, as always, for your hard work. And let me just offer you my first apology for the day for overlooking you and asking for the report out. So prior to today's meeting, the staff at OJA did provide each member with a copy of Senator Olac 9 Q2 report, which we are now considering for approval. If there are no questions, concerns, revisions to be made to the proposed report, I would entertain a motion to approve it.
Make that motion.
Thank you, Judge. There is a motion. Is there a second to approve the proposed report?
Second.
Okay, thank you, Angela. So we do have a motion and a second to approve the proposed report. Any further discussion? Hearing none, I will then call for the roll call vote. Start again with, Bernice, so I don't forget to ask you, can you hear me now? Yes. Okay, great. Bernice, do you approve the report? Yes, okay, so indicating yes. Steve?
Aye.
Zoe?
Aye.
Angela?
Aye.
Kelly?
Aye.
Daniel?
Aye.
Chris?
Yes.
Judge?
Aye.
Doug?
Aye.
Adam?
Aye.
Aye. Howard?
Yes.
Chris?
Aye.
Senator?
Aye.
Chris? Becky? And Derek?
Yes.
David? Yes. Michelle? Representative Gore? Okay. So the proposed report stands approved as presented. Thank you, everyone. Now would call for a report out of Bernice. I'm not sure if all of the logistics have worked out. Can we hear you? Okay. I don't think we can hear Bernice, so.
I'll go ahead and do it.
So, yeah.
Yep, it's going to be very brief.
Okay. Yeah.
Oh, she can hear you apparently, so we got the thumbs up.
Bernice, if you want to just mouth it, and then I'll act as, I'll try to be your voice. So we haven't met since our last meeting back in, I believe, May. At this time, the work of this work group has kind of been finished up. We finished up with the report that George Mason did for us. I met with Dr. Louder. I think she had presented her outcomes or the findings from that report at a previous JRAC meeting. Sort of talked to her about how we put a bow on that project. One idea that she tossed out was doing some outcomes, some dispositional outcomes research on the individuals that went through the first part in the in her, and the name of it is escaping me. Bernice, Are you able to like mouth what it is? No, I'm not. I don't want to do that. I apologize. But nevertheless, if you recall, in Porter County, Vigo County, and Marion County, George Mason worked with those counties to do an assessment for individuals that were booked into the jail. They presented a report that came out with some findings, but it stopped there. The next part of this report would be taking a look at how those individuals did as they went through the criminal justice system. The funding of that is obviously the big question. So Dr. Louder is currently putting together some proposals to look at that, but also to look at some of our pretrial data. That's something else that's a separate project, but potentially working with Dr. Louder on a couple of reports.
It was the relative disadvantage study.
Daniel Glass nailed it. He absolutely did.
Through Bernice.
All right. Thank you. The relative disadvantage tool. So thank you, Daniel. Thank you, Bernice.
Technology.
It's our tech workaround.
Yeah.
Well, Chris, thank you for jumping in and making adjustments on the fly. For
It was not. It was.
technical difficulties,
That was
so-
not my best work. So I apologize.
Well, nonetheless, it's still pretty good.
Thank you.
So, before we move on, any questions, members of the group? Okay, very well. So then we'll look forward to a future report then on what we hear from Dr. Louder.
Yep.
Okay. So thank you, and thank you, Bernice, for all of your hard work, all your important work in this area. Okay, appreciate it. So now I think I'm good to call on Angie for a report out from our data work group. So, good morning, Angie.
Good morning. Thank you, Justice Goff. The data work group first met on June 20th of this year, so we've been meeting bi-monthly since. We last met on October 23rd, and our next meeting is December 11th. We've reviewed the strategic plan, and we'll be completing a data survey for the organization representatives that are part of the group to create kind of a higher level network diagram of existing data, and we hope to have that done by the end of the year. The work group's also supporting the problem-solving court performance measures project that's going on, and asking the group to help develop a data dictionary as they go through with that. We've been asking for everyone on the work group, if you have data dictionaries to kind of start for common language, could you send those in? What we're finding is there are not a lot of them, and so that's like a gap that we need to address and look at. We are also creating a collaborative space in Teams so we can start uploading and communicating through that I guess platform, for lack of a better platform that we could find to do the same thing. So, and then I'll just say, if you have questions related to the data network diagram that we're looking to create, Brendan O'Connor from our office, from the Office of Judicial Administration Innovation area, is here too if you have any questions about that. So.
Angie, thank you. And Brendan, is there anything else you want to add or for the group about
Sorry, Brendan.
sort of a high-level view of your work?
I would say the data inventory, it's really a map, if you think about it. If you've ever wanted to use another organization's data, this is the answer to that question that you may have had. So think of it as an ecosystem map that'll help you navigate who has what, who owns it, and we'll tag it with additional metadata points of who the point of contact in the organization is from a data sharing perspective, as well as a technical perspective if someone wanted to answer questions about the specific data sets themselves.
Any questions for Angie or for Brendan? Members who might be new or members of the public or justice partners who work at the local level, kind of the beauty of the structure that we have in our state-local partnership is that if a particular county level system has an issue of concern in their sheriff's department, for example, that can be something that can be brought to the attention of their local JRAC. It can be kind of bubbled up through the Sheriff's Association, and it can be an issue then that we can take a look at through our process. And that's really what we're trying to do, is build a work group that can look at those issues that are sort of common to the justice system, that keep coming up on a recurring basis, and offer some ideas, hopefully, solutions that might work for your community. So Brendan has been a really big piece of that, and we're excited that he's joined our team. This is a way that we can share his expertise with the larger justice system and our county-based systems as a whole. And Angie has been instrumental in putting these things together from the get-go. So appreciate all of your work on this, and look forward to hearing more from the data work group. Excited about the work that you've undertaken so far, so thank you. Well, it's something other that else that we're really excited to share today. We have a presentation that we're going to hear from our friend Zoe and from Becky on certified community behavioral health clinics. A couple years ago, this whole group had a big inaugural process to sort of kick off our local JRACs by talking about some big changes in the behavioral health delivery system in Indiana. There's an important intersection between behavioral health and criminal justice, and a big piece of this has always been, what do you have to offer communities as an alternative to jail when somebody ends up in jail or in the criminal justice system because there's no other place for them. And so we're excited today to hear some more from Zoe and Becky about our certified community behavioral health clinics. So turn it over to you, ladies. Thank you.
Yeah, you just click. Okay. All right, you start. Yeah, so happy to start. So thank you for having us here today. Oh, wow. So we're just going to go to the end. Any questions?
There we are.
So hopefully at this point you all have heard of 988 and are familiar with the shifts that the Division of Mental Health and Addiction and others are doing towards developing our 988 crisis response system. And so this is the concept of someone to call, someone to connect with, someone to respond, and then a safe place to go. And so this slide just depicts that, the three pillars of our crisis response system. So 988 is that someone to contact, and then mobile crisis teams, which we now have 24 designated teams around our state, covering 91 of 92 counties. And that last county is just on the verge. We just need some final sign-offs to get that one approved, and then we will have our entire state covered by mobile response teams. And these, per Indiana code, are required to have a peer and a clinician as part of that team. And by peer, I mean a certified peer support specialist or someone that has gone through, that's the DMHA training, or someone that's gone through the training with Mental Health America to be a recovery coach or a certified peer. And then they have to be 24/7. So we do have a few spaces in rural areas where we've offered some waivers because of workforce and other challenges that they're not quite at the 24 hours a day, but we're really close to that. And then they also have to be able to bill Medicaid. And so this is part of the sustainability plan for our mobile response teams. And then a safe place to go is our crisis receiving and stabilization services. And we have 24 CRSS, in short, sites around Indiana. And just to give you an idea of the investment, so 988 kicked off in July of 2022. And since that time at the division, we have invested over $200 million in building out this system. A huge chunk of that, about $96 million, went to a place to go because we needed a lot of infrastructure build. And a lot of this was allowable and because of some of the COVID funding that we had at the time. So we used a lot of that to build up our infrastructure so that we can maintain it going forward. I mean, there was strategy in me saying you could go ahead and do it, right? So the next slide is going to be on the certified community behavioral health clinics, and this is a program overview. You also have it in your handout, so we'll allow Zoe some time to get adjusted there. Okay. So hopefully, again, you all have heard of our CCBHCs. Indiana entered into a demonstration grant, and we have 8 pilot sites around the state. And in those 8 pilot sites, on the left side is the list of the 9 required services that all CCBHCs must be able to do at each location. So it's not something where they can say, hey, we're designated, come here, but you need to go over there to get family support. No, you have to do it at every location to be designated. And what I really want to point out here is going back to that crisis system, it's not required per the feds, but Indiana included crisis services as part of our demonstration grant. And so what that means is once you are designated a CCBHC, the cost for the mobile crisis and the CRSS are part of your daily prospective payment system, PPS, rate. And so that is included in the sustainability of CCBHC. And so that is one space. I think Indiana does a lot of things right. I'm a little biased, but I think that's one of the spaces where we really, we were very strategic and thought that out and knew we had to sustain all that infrastructure build and all that work we did through those initial funds. And so that's one space we're doing that. So this map depicts our 8 pilot sites. As you can see, when we kicked this off, we wanted to do some rural, some urban, a mix. We truly looked at this as a pilot program. How can we figure out what's working, what's not working, and then move forward with hopefully expanding at some point. CCBHC does require a lot of data. So there are 21 quality metrics that we have to report out on. And we do have 10 required evidence-based practices and 13 recommended. And so what that means, for example, one of the required evidence-based practices is motivational interviewing. And for most people, that's just inherent. It's something they're already doing as part of their daily practice. And then we also have things like dialectical behavioral therapy that is a little bit more specialized, but it also is very effective for certain challenges, one of them being borderline personality. And so that is one of those areas that can be really difficult to treat. And so DBT is very effective in that, and so that's also one of our required evidence-based practices. Anything you want to add, Zoe? No?
Okay, so I'm gonna talk through this, and just for point of clarity, remember, I come at it from the advocacy lens, fierce advocate for community-based care, and so my comments might not necessarily reflect of the state, but it is around policy both state and federally. So I just wanted, when we do a joint presentation, be very clear on where my comments are coming from is as an advocate for community-based care. So this is the map of your community mental health system and your certified community behavioral health clinics. Each of you can have this map. I think it's a phenomenal resource to be able to know who in your area is doing what, and we are getting ready to update this with the crisis numbers that Becky shared. And I do just want to publicly recognize Becky and her team and DMHA, because as she shared, 988 was just a couple years ago, right? And it has taken, if you zoom out, 911 took a decade to build a full comprehensive, and the work that they've been intentional about as far as crisis response is evident in the numbers you shared. So I'm really honored to work alongside you with this. So this is the current structure. Of course, from an advocate perspective, our vision is to have all of the members that are listed here transition to certified community behavioral health clinic at some point as things move forward, both federally and through state policy. And Becky's going to share through data why this is so important as a system.
So as I mentioned earlier, there are 21 metrics and data points that our certified community behavioral health clinics have to produce. One of the areas that we are looking at is the social drivers of health. And so if you look at the critical factors like housing, transportation, food, these are part of social drivers of health. And as a demonstration grant, our goal is to ensure that 80% of the individuals that walk through that door are screened for the SDOH criteria. We are at 77%, which we're not at 80, we're close. Part of this is some data cleanup that we're working on and making sure that as a state, we're working with our providers to capture all the data. And then the other part is this is new for some of our providers. And so just having them get on board and basically set up their processes to make sure they're capturing this. The demo did start in January, so we're about 10 months in. This data, though, is back through August, I believe. And in this, you can see, go back, yeah, or as I'm sure many of you are not surprised by the fact that transportation is one of the biggest issues that we are finding throughout our CCBHCs. Housing is also up there, and then food insecurities, food issues. And we are, again, because we are now collecting this, we're going to be watching this over the next couple of months as well to see if there's other areas we can address. So while we only started in January, I just want to say that our numbers for the individuals we've served, I want to point out that the first number, the 35,000, is Q3 of state fiscal year 25, which means January, so we started in January, so it's that, technically it's the first quarter of the demo, even though it's the third quarter of the year. And then fourth quarter, our numbers went up a little bit, but for the total number of unique individuals, so there's some duplication in those individual quarter numbers, but the total number of unique is just over 44,000 individuals that we've served in our CCBHC so far. Okay, so I'm gonna hope all this animation works fantastic on these slides. So I wanna just take you a little bit through a story, and you can just kind of go ahead, because so this is David, and most of you have at some point in your career come across a David. He's 23 years old, born and raised in Indiana, has standard upbringing, high school graduate. He recently had some new mental health challenges and had private episodes of psychosis, ones that he didn't really want to share. Those episodes, though, have caused him to withdraw from his family. He's never seen a counselor or a therapist, and he recently lost his job and is having trouble meeting the basic needs, is on the verge of homelessness. So again, this is not a story that is new to you all, right? So David has some behavioral health challenges, lost his job, on the verge of homelessness, and he's visiting his family. He becomes extremely agitated and upset, and they're unable to calm him down. So what do? They call 911, which is historically the number one response for folks in a mental health crisis. Law enforcement comes. They are unable to de-escalate the situation, and his experiences get a little worse, and he gets agitated. And so they call EMS, and they take him to the emergency room, where he is unable to be calmed down, ends up having a hospital stay, and because of the resources that are available to him through that hospital, through that ER, his mental health challenges are not addressed to the point where he is able to walk out with a safety plan or a crisis plan or any additional resources. So he is discharged from that environment and continues to try to find treatment, but because of his mental state, is not able to access those resources by himself, and then he ends up having another health crisis in the next few weeks. So I just want to point out the slides in your handout should be the complete animation. This next slide, though, is not on your handout, is not complete because of the way the words look, but you have parts of it, so I just want to say that. So this is where we hope to go and where we are going. I would say at this point it's beyond a hope. I should not say that. This is where we are going with our Indiana's Crisis Continuum. And our vision is that in months, not years, individuals are able to get access to treatment in their community, what is right for them at the right time and the right place. And I just want to point out that even though this is an arrow, as you all most likely know, mental health is not a linear process, right? There's ups and downs along the way, but this is really just, keep going, is just to depict what we hope the new system will bring for our families. So there is a crisis, and David's family calls 988. The 988 crisis specialist talks to David and his family, but they're unable to fully meet his needs. So they say, hey, do you mind if we send a mobile response team out in order to help assess and further with your situation? So his family consents. The mobile crisis team comes out, and they are able to de-escalate the immediate situation, but recognize that David needs a little bit more help and is at risk of maybe having another episode in the next few hours. So they help transport him to the Crisis Receiving Stabilization Services, which is, by Indiana code, less than 24 hours of a safe place to go. So they take him there where he connects to care and referrals and certified peer support specialists who are able to understand his situation, help him feel comfortable, and then get him back home. The best thing about CRSS and the mobile teams is there's follow-up requirements. So they connect him with the services, but then they also are able to follow up and offer ongoing care and supports if another crisis arises. So the big things that have changed for David is that the family was able to call 988, and they were able to get access to a crisis specialist who has training specific to mental health that can help deal with his immediate needs. And then they help him with a personalized safety plan that helps in future instances, and providers that are within the same network. So there's continuity of care, there's communication amongst the provider network, and then he has a care coordinator who can help him with ongoing needs and help him keep track of his treatment. So I want to, again, our animation. So go ahead until you, so there's lots of stacks of dollar bills there. So what I want to say is that this average cost for an EMT dispatch, this is the average cost for a medical transportation, so ambulance. It does not account for anything that is billed on top of medical transportation by that EMS team, by law enforcement, if there's officers that arrive, if there's firefighters that arrive, anyone else that comes to that house. This is literally just the cost for medical transportation, and then the stay in the emergency room for about 3 to 4 hours for a hospital that does not get the hospital assessment fee. If they get the hospital assessment fee, it's about $400 higher. I just want to put that out there. So that average cost is about $955. It's okay. You can keep going. Okay. And then the average cost for a mobile response team to go out is about $489, $490. And so, okay, yeah, I think. So,
Okay.
So, yeah. So what that comes to is a savings for taxpayers of about $465 per response. Now, this is just early data that we've been able to gather and pull. Ideally, as our system gets more mature and we have more time, we will be able to pull actual dollars connected to patients so that we can show the specific savings as we are serving individuals, and then include a more encompassing cost. And then this is the data. So when you take that savings of $465 and you look at this data, it starts to get to really big numbers. And so with this, what I want you, this is a comparison of state fiscal year 25 quarter 1 to state fiscal year 26 quarter one. So when you look at that first column, it's going back to the crisis response system, so 988, you can see our calls to 988 have drastically increased over the year. And then that dotted line is the percentage of calls answered within the state of Indiana. And so what that means is we have 5 call centers, and if they are unable to answer the phone, it goes to a backup system through SAMHSA, through Vibrant, and then they then triage that call. So 95% of the calls from folks within the state of Indiana are answered by a person that is working in the state of Indiana. The mobile crisis, you can see again, this is the state fiscal year 25 Q1 comparison to state fiscal year 26. These are the number of responses, and then the dotted line is the unique individuals. So as you can imagine, some folks have multiple crises over time. And so we've had, for example, August of 26, we had 1,068 responses, and 888 of those were unique individuals. And then the same for the crisis receiving stabilization. So we had, you can see that our numbers from the different years have increased by 1,000 in the months that are going and getting access to the CRSS. Now, a lot of this has to do with a year ago, we had 10 mobile crisis teams designated and a handful of CRSSs. So some of this is due to just access in general and the number of resources we have made available to individuals, and that's a huge shift, but also the culture, the mind shift, right, of thinking that when I have a mental health crisis, I no longer have to immediately call 911. I can start with 988, and then from there I can get access to the resources.
So by now you're probably thinking, well, how is all of this funded and how have we gotten to this point of success? So this next slide, some of you in the room were on the Behavioral Health Commission that was led by our previous DMH director, Jay Chaudhry. And so this is a graphic that was in that first Behavioral Health Commission report about how funding was being done. And so as Becky said earlier, and it's important to connect the dots, that there can't be crisis without CCBHC or CCBHC without crisis. The state built it that way in Senate Bill 1 under Senator Kreider's leadership, intentionally knowing that we needed to have a sustainable plan. And so the long-term vision is for CCBHC, because otherwise you just have a revolving door, very similar to our emergency rooms, that then people don't get care to be able to get connected to. So CCBHC is very much a part of that vision. And so I'm going to hand out, again, the CCBHC to CCBHC piece here. And why do I keep giving you a bunch? It's only you. And so why I'm handing this out is I think it's really important, especially in these constricted times. You around this table are the voice of this success. It is not me as a provider. It is not Becky at the state. It is our justice system who really helped us, as Justice Goff has said, not only on Senate Bill 1, but remember when this group signed a letter for the federal demonstration that we now are heading almost a year into. And so this justice voice, your voice at the table, both on a local, state, and federal level to continue this model in the state of Indiana is absolutely imperative. And so this is our timeline. So just take you back in time. Several of my members received grants. This is a federal model, and so they were federally supporting this model. And so what happened is we built these services via this federal funding, and we didn't know really what the state plan was. And so we legislatively have put a number of bills here you can see throughout the years to be able to get to the point that we are, and will continue to advocate for that. So that is why I wanted to really share with you this timeline. We still have quite a ways to go for full system transformation. However, we have the various pieces of legislation to help get us there, but it's really going to be hearing from each of you in each of your spaces around the crisis response and the impact that you've seen in your local communities. And so that is my ask of all of you today on this journey to get us to full CCBHC transformation. And that's my contact information. I think everyone knows how to get a hold of Becky. And we just really wanted to thank you. I want to thank you for your support and your leadership of getting us to this point. We wouldn't have been able to do it without that. So any other questions or things that we did not go over that you guys have on your hearts and minds? Yes.
So Becky, I don't know who would be the appropriate one to answer this question, but I've encountered several of the organizations from our drug court, and I'm seeing, and I know we're in a more rural area, I'm seeing some staffing challenges.
Yes.
I think, and so we just finished talking about sort of the crisis with attorneys and ways to address attorney shortage, and I'm wondering if, as a state, maybe that might be something that we need to look at as well in terms of staffing. I think it's a better way to do business, but we want to make sure we're appropriately staffed for it as well.
Yeah, Judge, actually, the reason why I started down the CCBHC journey is because I was in charge of human resources at a community mental health center in rural Indiana. I could not find people, no matter what we did. Well, our rates, because of some of the private, places out, could not compete, and with the administrative burden constraint within our system. And so this is an HR solution for that workforce. Becky probably knows the numbers better than I do, but each of our demo sites have increased their staffing resources, to numbers that I didn't really think were quite possible. So I think this will be part of that plan.
Yeah, one of the unique areas within the demonstration that is allowed is infrastructure and build up to what you need to become, so to speak. And so the initial cost reports that were submitted by our 8 demo sites included additional funding to support raising salaries as well as adding staff. And so that is part of the infrastructure build around our CCBHCs. And we are in the process of pulling data from all of our pilot sites to ask how many staff have you added and what are the credentials of those staff. Because the other amazing part about CCBHC is we are focused on the quality of treatment and the staff that can provide those evidence-based practices as they were intended to fidelity, and not just having a body there to meet someone without the skills and the training, because that also leads into workforce retention. Because if you don't feel like you're adequately prepared to handle a situation, you don't stay as long. And so making sure that we're building up our workforce is a big part of this. So I'm hoping that we will have some of that data within the next 3 months to share publicly around the staff that have been added at our CCBHCs. But it also, we need to keep finding people, right? Because we can't have a finite number of workforce and then we just keep stealing or borrowing from each other. We have to be able to continue to build that workforce, and so that is definitely a priority.
Yeah, please go.
Yeah, Becky, you mentioned in the presentation David's pathway being transported to a hospital, but I think for a lot of people in this room, David gets transported to jail in many situations. And I know, this goes back to your earlier comment, not having a unified budget for a court system makes finding this number very difficult. But I know you and I have had a number of conversations. We've looked at the RAND Corporation's report. Do you remember kind of the rough number? I think that we really probably shouldn't be talking about in a public meeting, but that we came up with that sort of talks about the cost of that average 5-day stay at a jail, the response for just police to come and then transport that individual, and then the court costs that go into that, then not even then taking into consideration the reoffense and all the what happens after that, but just that initial response. Do you remember that number?
I do, actually. I might have written it down. So, as Doug mentioned, we looked at the RAND, and when we looked at property crime, burglary, and theft, which we believe out of the offenses listed are most likely to fall within somebody who has a mental health or addiction challenge, that cost, the average cost for one law enforcement response was just over $1,100. And then the 5 days in jail, again, this is based on $54, which is the DOC rate, is around $270. And then court is it not 54?
I wish.
42.
It's
Is that
42.
42.
Counties,
Okay,
right.
so, sorry.
We started on that.
Yeah, I didn't mean to poke that bear. And then the court cost would be around $307. So we're looking at around $1,000 of a decreased cost when it comes to having a mobile response by a trained team versus having to have law enforcement and then transportation to jail and then the courts involved in that kind of thing. So we can definitely work to refine that number, but it's about that.
I see Steve there and I see Bernice there. I promise I'm not going to move to it. And Senator Clark, I won't change the subject until everybody's had a chance to ask. So, but Steve, I saw you next, and then Bernice, and then
I was
Senator.
actually going down the same path that Doug was. Are you going to be able to put that number together in a way that we can use it with legislators and advocate for appropriate funding for the system? And because I was at the financial review and Mitch said he wasn't really comfortable with the number, and I didn't know which way he wasn't comfortable with it. But is he going to be comfortable with including the criminal justice piece? And then isn't there another piece too in terms of behavioral health care services that if you go down the original path, they're going to be a lot more expensive than hopefully the more appropriate path. So many times we make decisions and we don't look at the real numbers, and I'm just trying to find out if you are able to put that together that we could either as JRAC or as individual members advocate for it.
We are working on that. So I would say I see our responsibility as getting you the numbers for the cost for what we're doing, right? And then the numbers as the cost for the response. We can put together methodology and all of that, but I would love for that to come from this group of what is that actual cost for law enforcement response and then jail and court services involvement. The challenge, my understanding, Secretary Rowe, when we say that the response for a mobile crisis team is on $490 on average, his question is, what is the total cost for that team to exist? And instead of looking at, because there is a Medicaid bill rate for mobile response teams, and so instead of saying this is on average what Medicaid is paying per response, it's what is the total cost for that team to exist, and then how do we divide that by the number of responses, and then that gets us to an actual cost for that team to exist. So his questions are less around what is Medicaid paying, but what is the cost for existence. And so that is some of what we're working on with Secretary Rowe. And, well, I hope we'll get to a point where we can then release. He was comfortable with that number being released as long as it's explained and shared as this is the average cost Medicaid would pay for that response.
Because we did, just as a reminder to everyone, we did take the unusual position when Senate Bill 1 was out and say that we as JRAC supported that, and we used it in the advocacy. So just throwing that out there, that if there is a criminal justice piece to this that is legitimate for JRAC to weigh in on, I would love that if we had the numbers to do that.
Excellent, Steve.
I
definitely think there is. The council has done a ROI report with our fiscal Blue and Company, but it's a very high level. We are planning on updating that. So I do know from members, like we had an officer from Jeffersonville come to the budget and share the decreases, and a lot of those numbers were domestic disputes, and he really advocated for us, and so I think getting some of that more statewide would be really impactful. So,
Great. Thanks, Zoe. Bernice, and then Senator Clark, and then David. Okay.
Can you guys hear me?
Hey, it's Bernice. Yeah.
Thank you all for your patience. I'm so sorry that I was a tech mess this morning. Becky and Zoe, thank you guys for your presentation. And Doug and Steve are a little bit on the path I'm going to ask you a particular question about. Coming back to the example provided, the David that we're all familiar with. Your example made me think of the case of Joshua Larimore out of Jackson County. Sorry, in 2023, I'm gonna ask this question, folding in questions, facts from Joshua's case. So, like David, Joshua had a mental health episode, a little different. Neighbors called 911 out of concern for Joshua in 2023. The officers who picked him up saw he was in a mental health crisis, took him to a hospital. So just like David goes to a hospital. While at the hospital, David, let's say, pulls the hair of a nurse, like Joshua did. And then Joshua, or the David, gets, let's say, arrested. In Joshua's facts, he was in pretrial detention, solitary confinement for 3 weeks with no qualified mental health person following up on him. Ultimately, he ended up dying and losing his life. My question is, with a CCBHC structure, is it the case that once the David person is in jail, they are no longer able to have follow-up care? Is the person no longer able to receive help because they're incarcerated?
go ahead. So again, Steve and I worked on legislation. How many budget sessions ago? 4 or 5? 5? 4? 4. 4 years ago for a waiver for the incarcerated. And so that right now, there's some great work being done by Medicaid. They received a planning grant in the juvenile justice space, which is amazing, and DOC and other partners around the table are part of it. But until we get that, Bernice, you are right. There is still a gap of care. And so CCBHC, never will I promise it's the end all and the be all to everything. There's other things within our system to be able to really fill those gaps, and that waiver is one of them. So we will continue to work on that, and I really appreciate Steve's leadership on that policy, and then Medicaid moving forward with that planning grant. But we are not there yet. We have a ways to go for that.
I would also just
Thank you. Sorry to ask a question that might have been asked and answered.
I would also just like to say that there is funding through Recovery Works for treatment while folks are in jail, and so some of that requires that coordination between the jail and the provider, and often the provider in that jail is the same provider as the CCBHC or the local community mental health center, and so there are opportunities there. And that is part of the reason why Recovery Works even started, was to provide that gap funding. And so I do think there are other spaces, and like Zoe said, I mean, CCBHC is amazing, but it isn't the answer for everything, right? And so we do still have some other buckets available to help offset some of those costs.
And just as a reminder to the legislators in the room, Recovery Works, which is fantastic, did see a 50% reduction in funding in the last budget. So that is something to consider.
Thank you all. So I think Senator first, and then David, please.
So I had a couple questions that are not related to David, but then I do want to talk a little bit about David as well. The first is really from my dispatch center, and I'm getting a little bit of questioning regarding calls not going to 911 that are going to 988 and a lack of data sharing. In your example, even your data shows that David has called in a number of times, maybe 5, as one individual user. There's no record of that being shared with the police, right? So if times 6, David has a gun to his head and the police go, they have no record of David at all. So they're very concerned, and I don't know how that even looks, right? If there's some kind of a data sharing model, and this isn't a dig, but it's kind of important for the guys with guns going to these runs to know that maybe David has been down the response road before. Does that make sense?
Yeah, it does. And 988 is anonymous, and so there is no tracking of the individual's information or name to be able to then share that back. There are, when someone calls 988 and then it gets transferred to 911, they do in that time share that information.
Anything that goes to 911 is going to have an address of origin, right, or a
Yeah.
location. If it's a cell phone, it'll show you kind of an area. Pretty good now. But I think that's the problem. If we've been to 124 West Main to David's house, or you all have been, our response team from Cummins or whomever, 10 times, and then on time 11 the police go, they look, oh, looks like no one's ever been to David's house before. I guess this is just a normal run. But really, David's been, admittedly taken away or whatever a couple times. So that was their thing, and I'm like, well, I don't know how that would look, because I'm sure they're going to say, well, this is private, and if we try to say we're going to share our data with the cops, nobody will call. I get the concern there, but it is also a public safety concern to the point of cops going to these places with sticks and guns and sprays and tasers, and that, because that's what we do, right? If someone attacks you with a knife, you're going to resort to your training. It has nothing to do with necessarily the status of the individual involved, because we don't know it. At least if the police are going, there is an established kind of record of response that I can see in my computer when I'm going to a run and say, hey, Dean, you guys have been here a number of times. David does deal with this. He's got an affinity for knives or whatever it is, so at least the guys go in wide-eyed. So that was one thing that's been brought up.
We do have 61 PSAPs that we are working with to talk through the 988 and 911 interoperability and the exchange. And so that is an area that we haven't figured it out, but we are having conversations.
That's great to hear. So I'll relay that back to my folks.
Yeah.
The next one would be regarding the old CMHC model. It seems there was never competition when I would attend the county council meetings, that they would just basically write a check to the same entity every year. And we tried to adjust that as we go forward with the CCBHC model, in that, maybe if the cup company is really better than the glasses company, that's better than the pen company, so the best one wins, kind of. Like any other business adventure, we would do that. But unfortunately, government, we'd seem to just kind of go with the cup company because we always have. Is there going to be some thought to that, like who gets the county money?
So that is a county decision.
Okay.
And there are steps in code that they can take if they are not happy with their current CMHC provider.
Okay.
And we recently had an example of that Senator Kreider we worked with for Hancock and Shelby counties, and they changed their CMHC designated entity.
Okay, good. So at least the path exists.
There is a
I don't want to
path.
come across
There's a
that I'm
path.
complaining about any of the ones in the counties that I have, because I am not. But I know in my past life that was
Yes.
often the topic of discussion.
And if anyone hears of that being a concern, I would encourage reaching out to Zoe and us, and we would be happy to start having some conversations and figuring out what's the challenge, and then help identify the next steps.
And finally, David, right? And you know I'm an advocate. I've been around the table with all of you for a while now. But the key to the timeline with David is his consent, right? Or the assumption is the police just fail and they can't de-escalate. I think we have to really emphasize the importance and stress CIT is really good, because there are going to still be times when the cops come. If you folks can't de-escalate, as much faith as I have in my team, you're going to call the cops in there. So the CIT has got to be, I think, a part of the timeline and say, hey, we love the CCBHC, but it has to include CIT as a piece of this, as well as things like recovery works, because if the guy, David, does punch the nurse, nurses are really nice folks, but they really want us to pass more legislation that says if you do that to them, it's even elevated more.
Yeah.
So I doubt if nurses are going to go, oh, Dave, he's a good old guy. No, he didn't mean to knock me out. But that just doesn't happen, right? So David would go to jail there. And then finally, I would say that if he is ID'd by the police or detained against his will, he would probably go to the exact same hospital that the team would take him to. Now, maybe rural could say no or something, but in today's modern law enforcement, the first reaction is not jail. Like the Memphis model 30 years ago probably was, right? We had no other alternatives. Nobody was trained. the police go through a lot of training now, and I'm not just gonna be here as the police, defender guy, but a little bit, because they do get some good training because of the work that all of you have done collectively leading up to this point. So I really think that David is unlikely to be jailed in that situation if his only crime, quotation marks, is suicidal ideation or threatening his mom or whatever. Now, if he attacks the police officers or jerks the nurse around in the ER, I don't know that anybody would say that that's okay necessarily, right? I think there's some leeway there, certainly property damage, those kinds of things, like, well, okay, the public display of nudity, all that type of thing, but certainly not damaging another person. And even in those cases, and I'll be done, is that law enforcement is typically your mode of transport. Usually the cops are taking David to the stress center, not the ambulance. Now, if an ambulance does, and certainly that happens, I've seen it, they don't want to take David, usually, especially if he's bouncing off the walls and fighting someone, they will refuse often. And if they do take David, they'll bill his family. So they'll send them a bill for money to pay for David's transport. But anyway, that was my 2 cents. But saying all that, please know I'm still an advocate, all in on this. We were Pilot County for Recovery Works, right there with you. So I hope we can continue that, especially in the funding going forward. So.
Yeah, and we appreciate your advocacy, Senator Clark. And I will say that in the meantime, what I have seen successful is in the local communities. It's really a local community-based approach, and the providers working with the police and collaborating, and those who work collectively like that have had the best results with CIT and with all of the various supports. Is that across the state? No. Is that the vision? Absolutely.
Yeah, I'm spoiled a little bit. I think where I come from, we had a pretty proactive group there.
You do.
Which I
Yes.
commend them.
You
They're the
are
ones that
very
did it.
spoiled. Yes.
But that was pretty nice because
Yes.
I get it. Some probably don't
Yeah.
get along as well.
Yeah. I know we don't have that in every county, but yes.
Thank you.
Yes.
Thank you, Senator. David, please.
Yeah, thanks. Appreciate the progress you're all making. I so enjoy coming to this committee and seeing the progress we've made over the several years. I think this is a huge step. You mentioned that transportation was a problem for the subsequent treatments. How are there objectives to how to address that, or?
So as it relates to the CCBHC, because the reimbursement is a daily rate based on interaction and the type of service that's provided, so the provider does not just get to automatically bill that every day, but as long as they do certain services for a certain amount of time, then they can bill that daily rate. And so transportation doesn't matter. So they are more flexible in going out to the individual and not necessarily requiring that person to come to them. It gives them some more leniency in that. And then we've also have other projects that we're working on where we have funding to support Lyft rides and things like this, but we don't, as a state, I don't think we have a great answer for transportation and open to ideas and creative ways to address it. But it does, this model does help a little bit with that.
Thank you. Yeah, please, Daniel.
2 questions. Thank you, Justice Goff. First question is, when you say that it's saving taxpayer dollars, and I used to be the analyst for FSSA, or not for FSSA, but Health and Human Services. Now I'm not in that realm as much. When you say saving taxpayer dollars, do you mean primarily for those that are on Medicaid and Medicare, or is there something else that taxpayer dollars are being saved for? And then my second question on that is, who's seeing the benefits, not the right word, but benefit of it?
Savings?
Is it the local, is it the state? Because if law enforcement is deployed, generally that's going to be, unless it's state police, that's generally going to be local benefit. If they're in there, if they're not going to a local jail, DOC is not going to necessarily see a cost to someone spending 5 days in jail unless they're coming to DOC or they're an F6. So who are those, who's benefiting from that savings, and then is it outside of Medicaid and Medicare, those savings being realized for the state or the taxpayers?
So right now, the cost for our CRSS and mobile teams, so mobile teams can bill Medicaid for responses once they identify that person does have Medicaid. However, it's not a requirement. So before that team goes out, they don't ask, do you have a funder? They just respond, and then on the backside, they ask, how are we gonna pay for this, right? And so DMHA uses our state appropriation to help offset that cost. And so the taxpayer savings is based on us then being able to reallocate our state appropriation to have more teams and more responses, so then it reduces our appropriation to fill that gap, if that makes sense. So it's really a savings to DMHA right now, so we can reallocate that money. We are covering the cost of the match for CCBHC for the pilot sites, as well as the cost for the CRSS, as well as the cost for the mobile crisis teams that's not billed to Medicaid through our state appropriation, as well as our crisis funding. Some of that comes through our federal block grants, because that can be used for, the mental health block grant can be used for the crisis.
Yeah, please. Just really fast, we're talking a lot about all the dollars, and just to put your minds at something more ancillary that still would save money. I would think it's still early days, but I would think over time I'd be interested to know if there's a decrease in involuntary mental health commitment proceedings because of earlier intervention and deferrals, and then that would save public defenders who represent people, state dollars and local dollars, court time, court cases, and then also availability of beds at mental health commitment beds, and whether or not that they're able to avoid diversions more and have more bed availability. I think those would all be huge impacts that may are worth studying.
Absolutely, and I thank you for bringing that up. I really appreciate, because that is one of those down the road that we are definitely not there, but we are committed to providing our data so that then other systems can use that to say, in what other ways are we bringing down the use of beds and other things. But also, I know the Secretary is very, very interested in digging into the incompetent to stand trial and the civil commitments, and so that is definitely an area of focus for us. Yeah.
Please, Chris, yeah.
Thanks, Justice. Thanks, Becky and Zoe. I'm encouraged by the 988 model, and Doug and Jay, we had early conversations about CCBHC, so you guys shared the merits over the mental health center, so I appreciate all that. I'm interested to get your guys' thoughts, and maybe Steve too, on the potential of long-term institutions for those with serious mental illness. And it's several of us were in a meeting this week where multiple legislators expressed strong interest in that, so it's somewhat relevant based on perhaps those legislator comments. So I'm interested to see what you guys think about that, because it's unfortunate when someone with serious mental illness gets in the criminal justice system when they commit crimes, but that's a fact of life. That's a reality that has to be dealt with. Is it possible that such an institution would save 988, save costs for CCBHCs for the Davids who truly need the CCBHCs? Because the other aspect of this, you talked about burglary, being one of the frequent flyers here. Let's not lose sight of the fact that people die in burglaries, attempted burglaries. That's somebody breaking into your house. It's happening every day. People are dying in those situations. Not to mention violent sex assaults, other violent crime, right? These aren't hypotheticals. So given, that background, that potential, what do you guys think about that?
Well, I'll start and then I'll let you guys. So one of the spaces around the human cost, right, of changing our system and having a new vision, we have not, again, that is something I hope we get to. We're still early enough on, because one of the areas we talked about is when you have a response to a family, and that if they are the only caregiver and they end up in the hospital, then do you have to call out DCS? Do the children then get removed, right? And so I think we can go so many different ways with really looking at what is the human cost. And so I hope that we do get there where we can look at both of those. Long-term institutional care is, for our state hospitals, that's immediately where I go when you when you use that is, that's our state psychiatric hospitals. And those are very expensive. They're $2,000 a day. And there is a very small subset of the population that might need that long term, right? And I think by focusing on the institution, then we sometimes lose the opportunities that exist along that continuum. And there have been so many advancements in medications and treatments and evidence-based practices, and I would hate for us to lose sight of those opportunities, and know that if folks are getting access to the care, and you know, Steve, I don't know, you might want to talk about our ranking and how we've come up, right? But we were not doing so great, and so I think giving our system some time to see the benefits of improving our mental health system before we go back to where we were many years ago. I think that would be my concern.
I think so. I think this is hard to answer in this in a couple of minutes, but I think our view would be that we need a continuum of services for people, and we need to fit people into the services that they need as opposed to the services that we have. And sometimes we've had state hospitals and we would put people there and that wasn't appropriate. Sometimes we do need some kind of inpatient care and we don't have it because of funding reimbursement. And so people are in the community with insufficient support, and that's not appropriate. What we need to do is, if we were to step back and start over and think about how can we best serve these people, and it is going to require a majority of people in the community with some inpatient and some long-term care, but smaller numbers that are more expensive as you go. It also connects to all of the issues that you've been involved and we've all been involved in the State House in terms of the hospital care costs. On the one hand, legislators want to save, as we all do, want to save money on health care, but the truth is we're probably not putting enough money into psychiatric care in hospitals. We make bad decisions about we want to save money on mental health medications, but that's the way to keep people out of institutions. We have an odd reimbursement system for long-acting injectables that if we actually put a little bit of resources there, it'd probably save in terms of institutionalization. So it's all big. It's all a big question. Yes, someone should sit down and do assessments and analysis and plan it out. And that's not how we do things. We just make decisions as reactions, and then we end up with a disjointed system and wonder why it costs so much and it's not effective.
Thank you, Justice. I didn't mean to put anyone on the spot, but I think it is a relevant conversation. And I didn't want to be flippant either, but there is a cost. I mean, talk to your family and friends. If they've been a victim of a crime, they're not too concerned about the cost of 5 days in jail. I mean, not to be flippant, but there is a societal cost to this if it's not done the right way. So thank you, Justice.
So Chris, what I would say is, back in the 1960s when JFK wrote the Community Mental Health Act, it was a phenomenal vision, but it came without resources. And I think Indiana did its best, and I'm really proud of the work that Indiana did. However, without having a true infrastructure for true community-based care, I can see where people would make that jump. Now we have this model, the state has committed to it, and I would hate to divert our vision and divert our dollars to not really see it truly be successful to what community-based care. But like I said in my introduction, I'm a fierce advocate for that, so I know that's where I come from.
Thank you, Zoe. Thank you.
And, oh, I'm sorry. Go ahead. I was just going to say one other thing, and Chris, you and I have talked about this. I have a view that there are people that are inappropriately placed in the corrections system, but they are a public health risk or a public safety risk. And when we changed the level 6s that could go to DOC, I'm not sure what the numbers are now, but I checked once and it was over 1,000 people. of those 1,000 people, I'm gonna guess 80% of them have behavioral health issues and could probably be better served in a forensic public safety institution, like medium security kind of thing, with behavioral health supports. That's probably better. No offense to anything that DOC does, but it'd be focused on behavioral health. That makes sense to me.
Yeah, and you point out there's a breakdown somewhere, because for a level 6 to make it to the DOC, that's repeat. I mean, it's at least 5 arrests, probably at least 3 felonies. So there was a breakdown somewhere if a level 6 is inside a DOC prison facility.
It's really hard for me not to be talking on all this stuff.
I hope you do.
I'm right home here.
Happy you're here.
So I think a lot of that, some of that, to me, is federal fixes, right? Some of the definitions of what a mental health vet is from the 70s, when they tried to make sure nobody went to the hospital, God forbid. I've tried to get the feds to listen to me on that one, and they will not. But I really like the long-term injectables, and I think the holistic approach is the key to it, because we do need places for long-term beds. And everybody's got this dreaded fear of Central State 2.0, but I'm a new legislator, and I would be interested in some kind of, not just close everything and throw them all in an institution, because that's what failed. But the reason we institutionalized people to begin with was there was too many people in county homes, in cages, in the basement, literally in Danville, or there were too many people in jail, so we institutionalized. Well, then Kennedy's sister and all the lobotomies and the institutionalization of horrific stuff, we got away from that. And now we're talking about it again because too many people are in jail. So it's like a swing that keeps going back and forth. So you're exactly right. I think that we need to do it sort of holistically, but some of those beds need to be there, not necessarily in my mind for an alternative to prison, as much as my mom is taking care of me. I've got the intellect of a 10-year-old. I'm now 57. She's 82. And she dies. What happens to me? I either go to jail or become homeless. There's a place for folks like that that are not able to take care. And if we do anything as a society to help folks, it should be that, I think. And to your question, Daniel, I think regardless if it's the state or the county or the health department or the surveyor's office that saves money, the taxpayer, if we're actually here for the folks, they would save money because they pay the salary of all of us, right? Every state or federal or town or whatever. So I think that's where that is. And finally, one, and I promise I'll be done, to commend you all on this response team thing. I love that. You know why? Because the big thing before was, well, we need to put social workers in the car with the police. That would solve everything. No, it wouldn't. If a guy works 12 hours and this lady's riding with me for 12 hours, we might have a mental health run that night, or we might have 6. But she might be on the mental health run for 1 hour, at lunch with me for another hour, and then 10 hours of driving around, stopping cars, working crashes, and serving civil papers. So thank you for this approach, because putting people embedded in cars, as great as that sounds, is not great to me because it's dangerous.
Yeah.
Thank you, Justice.
No, thank you.
Can I just say one more thing, Justice
Yeah,
Scott?
please.
Okay. So, Chris and Senator Clark, there is also an infrastructure that my members support, which is our group home, community-based.
Yeah.
Keep in mind that that is not supported by any sort of operational incentive for them to do. It is paid for services. So we've had legislation several times now, and it will be 4 years, mid-November, that I've been at the council, to get support of those group homes. We've had a compression of those beds that have gone down, because who does business that you don't get paid for? I wouldn't, but they do, and they have had to really evaluate that. So I think some group home and some dollars to build that infrastructure maybe could be more of a solution versus maybe another
And even the people in the state hospital, I think
institution.
there's a number of folks who are not, I don't want to say
That would
fixed,
help with
but
that.
so-called fixed, right, that could
Yes.
go, but they have no support net to go. So they're just still living there. It's like, well, we
Correct.
can't do anything else.
That
We're
would
we're
help with
compassionate
that.
people, so
Yes,
so I
yes,
think
sir.
that would help.
Okay, well,
Thanks. Yeah.
we'll
Yes.
work with you on that.
We will not discharge the homelessness.
I know.
And so that is, it's great.
And that's a
It
good
also
thing.
creates a barrier for people to get out.
Yeah,
So
because then the
group
input
homes.
is lessened because the output
Right.
is not moving.
Correct,
Right.
correct. So would love to work with you on that.
So this is what I'd want to propose going forward in the half hour we have left. I want to make sure that we leave sufficient time for Angela and Kelly to present their presentation they've worked hard on behalf of all of the probation officers and community corrections employees across the state. These folks are responsible for providing the supervision of those folks who are serving out sentences or being supervised on probation in our communities. And they wanted to make a presentation on just how recent funding cuts have made it much more challenging for their constituents to do their work. So I do think it's important. I'm very thankful for our legislative partners who are here, because that's something that needs to be said in this conversation, is we are operating and doing our business in a time of very tight budgets. I do just wanted to put a bow on that conversation to offer this perspective and to tell you why I think it's really important for you as statewide leaders of very important constituencies in our justice system. Please try to communicate what it is that we're trying to do here to your constituents and ask them to engage in a productive way, because we have finite resources to provide public safety. We have finite resources to provide community mental health. From my perspective, I've been working on this now for, at this level, for over 6 years. Who was in this original visit to Deadwood, where we went and learned about this on a national? So Senator Clark was there, Doug was there, David was there. Is anybody else was there? But this is an issue that everybody deals with across the country, because we have this big deinstitutionalization issue. We had folks with behavioral health issues that used to be in state institutions, either a hospital or a state prison, that in the last 10 years in Indiana, but it's been that way across the country, have now become a community supervision issue. And as was stated, that was never properly resourced. So the way I think about CCBHC, and you know, Zoe, you're here, Becky, you're here. If I'm wrong, tell me, because this is what I'm going to ask all of you to talk about with your constituents. Is this is a capacity builder. What this does is it allows your community mental health centers to do what they were intended to do. It's not perfect, but it's significantly better. And I can tell you also from somebody who's done this, I think that there's going to be something that's going to be beyond the ability of our CCBHCs to do. I think there are going to be a population of folks that are going to need to have meaningful state placement. And so we heard from Representative Jeter at this Bail Commission meeting that he thinks that it is necessary to be looking at that bed space. Chris, I appreciate that you were at a training a week ago that was put on by our Office of Behavioral Health. We learned that there are only 800 beds statewide to deal with folks with serious mental illness, and I think 79% of them are conducting competency restoration services. So I just ask you to think about that. That does not provide mental health treatment to folks. That makes them competent to go back and stand trial. So that's, I'm not a math guy, but 30% of 800 beds is the only space that we have available to provide these services. So this is what I think, and I mean, we need to be engaging in a meaningful way with our constituents about what does that look like in your community. We have a partnership with NAMI Indiana to go into your counties, to go into all of your constituents' counties and conduct sequential intercept mapping of your behavioral health delivery system and how it lines up with your criminal justice system. Sometimes, you know, to Daniel's question, you're going to have a bottleneck at the jail. You know, Chris, I had a low-level docket, and so my problem was I had all the domestic battery folks, and I always had my jail over capacity. And so some of the decisions I was having to make were, we've got some dangerous folks that are being held on less serious crimes. I did not, and sometimes I'd have my sheriff calling me and say, I need you to let these folks go because I'm at 120% capacity, and it's all being, you know, because of drug dealers or burglars or rapists or people that are really serious charges. It was necessary for me as a judge with low-level criminal docket to build a meaningful relationship with my community mental health center so that those folks who could be somewhat stabilized could be released safe with an electronic monitoring bracelet or some kind of treatment to be able to have access to that and understand that we only had a finite supply of those things to make that possible. So it's a very nuanced thing. It's not something that lends itself to, nobody's saying release dangerous people. People are saying, how do you keep communities safe with finite resources? And the answer is going to look different depending on the community that you're in because of our very complicated structure of state government and the way that we pay for things in Indiana. And so none of us can do that by ourselves, but I can tell you our communities are going to be less safe unless we commit to doing that important work together. So I would just say that, you know, I think Chris brings up a good point. I think we do need additional state beds, but I also think we need to be working on our competency process and ensuring that, because right now you have a lot of judges that will have somebody go into their justice system And the attorneys who are involved in the case, public defenders and prosecutors, will be saying, we don't have anything else to do but question this person's competency, and they get into the system, and then they start, using up a bed. They start using up these really expensive resources. If they had access to some of the stabilization services at CCBHCs, you would probably pretty quickly be reducing that burden. That's always been the goal of this, but it's a really complicated federal funding package that has to go through the executive branch, and then it has to go into to the judiciary, and we don't have a unified system, so all I can do is say, please. That's all I can do, and you have to tell all your constituent groups the same thing. So please, it is really important. It's really important for the money aspect, but I can tell you, as somebody who had that docket, I think the work we did, it wasn't feel-good work, it was keeping people safe from violent crime work that I thought was really important, even though I had a misdemeanor and an F6 docket. That's why I did it. And I did it for 12 years, and it was pretty safe under my watch. So I'm not special, but there's a process that works. If your folks do that, it'll work as well as it can possibly work. And then we're in a position to say, we need this resource to actually do it better. And we can be a louder voice to people like Senator Clark, who's here at the table wanting to listen, when we say, no, this is something we really need. This needs to be a funding priority. So with that, I'll stop talking, but if we could take a 5-minute break, and then we'll come back and we'll hear from IACAC and Popeye. So do we have a high sign? We good to go from our TAC folks? Thank you. I'm going to call us back to order then. And Angela, Kelly, thank you so much for being here as usual, and the floor is yours.
Well, thank you very much for having us, or allowing us to do this presentation. We greatly appreciate it. IACAC and probation have worked well together for a long time, but particularly when we received notice of the budget reduction, we came together immediately to try to find, to resolve that and figure out other solutions and other resources. Part of it was at our summer assembly, and we did invite several people at the table to come and talk to us about other grant opportunities, which was very helpful. However, they also have limited resources, and so it's just everybody's feeling the pinch, and we understand that.
We also did a joint presentation at the interim study committee this summer, and so we were able to get in front of Senator Freeman and his group together. We're doing the same thing with the same people.
Yep.
So the first slide is the value of community supervision. We represent proven cost-effective alternatives to incarceration that promote public safety, significant cost savings, rehabilitation in the community, stronger communities that allows people to stay home with their families or be near their families, and it also connects them with employment. And it reduces systems, dangerous overcrowding in jails and prisons while maintaining appropriate supervision and accountability measures in the community. So, did you want to add anything on that?
I think just factually, we all agree that community supervision is more cost effective than jail or prison. And so when funds were cut at state levels, like it's decided on, we know it's cost saving, so then what are we supposed to do at the community supervision level with less money when the bottom line is wanting to save taxpayer dollars?
So just some statistical information. On average, community supervision agencies serve over 106,000 individuals daily. That does not include the individuals who receive services from problem-solving courts, pretrial, jail treatment, and other DOC-supported programs. That adds at least 8,500, if not more, individuals, and that again is on a daily basis. Combined individuals served in the community would fill approximately 80% of the DOC beds.
I think it's important for that middle box to note that what has suffered the most with the 2026 cuts are the problem-solving core. It's the pretrial services. Some departments and counties have had to completely wipe out those programs that they have because of the DOC cuts that we have. And I've been in this game 20-some years, and I believe the problem-solving courts, our peers, the community-based supervision is the game changer. And then it's just going away. And
That's a great point. We've worked really hard to get where we're at, and now we feel like we're just at a standstill and going backwards. So one of the things is to relieve prison overcrowding, again, with the 106,000 individuals served. If our services weren't available, and potentially we may not be able to take as many people as we would want, put them on waiting lists, so they may eventually or just go to DOC instead. That's 80% of the DOC beds. And by diverting individuals into the community, and I know a lot of you already know this, we reduce the financial burden on taxpayers, we prevent dangerous overcrowding, we free up valuable bed space for those who really need to be in prison, and we support rehabilitative efforts outside secure facilities. So another thing to note is we haven't received, community corrections budget has not received an increase in over 7 years. So now we are dealing with not receiving an increase, but also being cut. It's just a heavy, and community corrections agencies do collect fees, but that's a heavy reliance on unstable user fees from financially struggling participants. And we are limited with our local funding, particularly now with Senate Bill 1 and the property tax restrictions. That's really going to impact us locally. And operations, the cost of the operations continue to rise while funding remains stagnant. So from what we have seen, the results of underfunding can be potentially increased DOC commitments. It will definitely diminish our service capacity, which will lead to not having the program capabilities that we need to have to serve the individuals properly. Workforce instability, we are already seeing voluntary staff departures for more stable employment. For example, community corrections who do not have salaries dictated by statute are taking opportunities to go over to probation. And it's also eroding collaboration because locally we have to make those decisions on where to make the budget cuts, and it's causes a lot of dissension.
To piggyback on that a little bit, the probation salaries are state mandated, and I want to thank Justice Goff for the Popeye being able to get a salary study that was conducted a couple years ago in front of the Chief Justice. The study shows we are underfunded for the profession itself, which then just makes it worse for what Kelly just said. Ironically, I was on the phone this morning on the way here with a local community corrections director, or a court services director, and he's looking for a new community corrections director, and he opened it up and he got 0 applications from others from around the state. He has internal applications. And so his question was, do we see any increased funding coming along the way in the future? His judges wanted him to do a nationwide search, and he's like, it's going to be embarrassing. He goes, what we're paying a director for community supervision, he goes, I can't even get applicants from within the state. And so I'm like, ironically, I'm sitting outside of a building and going into the state JRAC meeting, and this is going to get discussed. But those are real examples of some of the struggles that we're having within community supervision of not even being able to get applicants to apply.
So some of the immediate strategies we have deployed across the state, different agencies, to prepare for the 2026 budget cut is we established hiring freezes, and some have had to lay off staff, looking at increasing caseloads of mostly already high caseloads, and then again reducing programs. So our evidence-based programs that we provide that are proven to reduce recidivism are now going to be cut because we don't have the staff or the resources to provide that. So critical considerations for sustainable funding. Again, just a review, immediate fiscal impact is budget cuts will directly increase jail and DOC commitments, resulting in higher taxpayer dollars. It's a broken promise of reinvestment. The JRAC legislation intended that savings from reduced DOC commitments be reinvested into local community corrections, and we see this as a promise not being followed through with. A policy reversal risk. A decade ago, individual criminal code reforms wisely prioritize evidence-based treatment over costly incarcerations. So these cuts threaten to reverse that progress in its entirety. And then we also are going to be looking at the funding formula that requires, in our opinion, and I think DOC would agree, that we really need to re-examine that and how the funds are prioritized using evidence-based practices. And this is just the funding. It's on your last page. The actual funds that were received in 25, how many funds were requested and then actually awarded for 26. And then, of course, we are also anticipating 27 to even have a higher cut, so it's concerning.
Thank you.
You're welcome.
I wanted to ensure that we gave Angela and Kelly an opportunity to have this space. I began receiving calls from probation officers, community corrections directors, just saying this is really a problem. And it bothers me when I see that the broken promise aspect. I was local judge when JRAC was created, and really believed in the idea if you can plug into a process that you're going to receive some benefit from doing that. And that's really when I say sequential intercept mapping, when I say all of these things that may make some local stakeholders frustrated, there is a process with our non-unified system that has to be followed so that we can understand in a uniform way where these scarce dollars should be prioritized. And since I've been here, we've really tried to make sure that we're in a position to be as responsive as we can be to locals. I really think that our priorities should be driven in large part by local needs, and then we can come together as a collective group of statewide stakeholders and come up with some acceptable solutions. Sometimes it's difficult to do that because we represent diverse groups with different priorities, but if ever there's been a time, I think it's now. It doesn't hit well, I suppose, to be, the member of the public and say that these things are going to go away. That doesn't necessarily mean that there's going to be a lot more space to put people in prison. That just means if they go away, these folks that can be supervised safely probably just won't be supervised anymore. I mean, is that the implication of what you're saying?
Yes, I mean, if there's no beds at the jail or prison available, then locally we'll have to determine who gets supervised and prioritize supervision. So that's exactly right.
We're short on time, and we're not going to solve the world's problems today, but one of the things that I would like to suggest is that with respect to addressing this as best we can, helping our partners in the General Assembly understand how they might meet these local needs of their local justice professionals as well as possible. I think we should make this an issue to be addressed by a work group. It makes sense maybe to be the local JRAC work group, and maybe we can task some folks with some ideas. And so, you know, if you want to reach out to your constituents, Kelly, Angela, that would be helpful. But, you know, I just say that to everybody here. Chris, Bernice, if you've jumped off to some of the things that you see locally, Zoe, you know, your folks are really critical to a lot of these things too. I'm a fan of problem-solving courts. I always have been, because that was the game changer in my community. Having a drug court, it allowed me to sort of know who was likely to be a crisis unless there was an early intervention. And I think that we were able to respond to some of those things much better. We've gotten really efficient in our ability to do that, and we've passed some rules to try and make sure that our prosecutors and public defenders didn't have to be there any more than absolutely possible, because they have staffing shortages as well when they go through and do that. But I really think that there need to be some collaborative solutions. All of those folks at the local level, they end up sharing responsibility for what a state institution would otherwise do. And that doesn't happen unless they take some time and sit around the table and talk about where the priorities are and what should happen. So I can't promise much, but I can promise you that I'll do my best to look at this, and I'll do my best to make your points and the urgency of your constituents known to our partners in the General Assembly so that they can understand it. And you know, Daniel's there. I appreciate his willingness to be at the table for all of these things. We've got a complicated structure, and these are trying times, but we'll get through it, and we're committed to doing what we can as a group. So,
Thank you.
thank you.
Justice Scott,
Please,
would you
yeah.
mind if I
Oh, no,
made
no,
a comment
please,
real quick?
yeah.
Okay. I just want to make sure that everyone in the room understands that it's not that DOC cut the funding for this, that it was a funding appropriation reduction. So I just want to make sure that that's clear to the room. And secondly, you know, there was something in the presentation about the funding formula. We did have a committee. Angela, I believe you were a part of that committee, or was it, oh, maybe it was a person before you, sorry. But Popeye was represented, ICAC was represented, and we had that committee, and we did come up with a new funding formula. Obviously, there's a process to change that because it is an administrative code. We are actually looking at now for a way to do it legislatively, and instead of going through that administrative code process. So we are talking about that now, just so that everyone is also aware. And then there was also a mention of the pretrial and jail treatment, and I know Justice Goff, we are committed to sitting down with Justice Goff and a team, I think, to discuss that sometime in the future.
Yeah.
So I just wanted to make sure.
No, Chris, you've been excellent. Liz and Angie's here. I mean, you all staff up these meetings so well. I think it's probably a time to make sure we're doubly engaged in this, because the locals that are really keeping our communities safe are feeling the pinch, and I know we're all here because we're committed to making sure that they have what they need, and they just don't right now. And so we need to make sure that we're doing our level best to address those needs, because we're kind of the fire brigade. So I thank you as always. I know you've been partners throughout, so I appreciate that, though. Thank you. It's an important clarification. We are over time, so I want to make sure then anything else?
Yeah, just one
please, Dan.
question.
Yeah.
Just for my knowledge. So the appropriation in 24-25 was $72.6 million. And I'm just going to use that one because we should have, hopefully we have data for this. How much investment did the locals make in community corrections in last, like, what, does DOC, do you guys have that number that I get from
We
you?
don't have that off the top of
No,
our head, Daniel.
that's fine.
Are
but-
they like the local areas?
Yeah, like what if the state was putting in 72.6 million, how much did the counties put in totality from that standpoint, because I think what the question is, we're talking about all of these services cut, and my recollection was that there were some counties that didn't put hardly any, weren't able to put any under this, and so I'm curious how much investment is there. If there's a cost savings, there's surely a cost saving to local jails as well for these folks not being in the local jails, and so how much money are the local jails saving that maybe the locals, I understand Senate Bill 1, but maybe the locals, if it's a savings from that standpoint, in my mind, not speaking as, just speaking as Daniel, take that out of the equation. If it was me, if it's saving my community money and my taxpayers' money from that standpoint, there would, in my mind, if this is truly as beneficial as everyone has explained it to me, Liz and Chris have done a great job of that, I'd be investing more, and I'd be trying to find a way as a local community to be investing in this from that standpoint. And so I'm curious, if there isn't any investment from a local community, why isn't there? If it is, if these different programs are truly making that change, and we're not going to solve this today, but I'd be curious to know kind of what was the total local investment in these programs, and because when we're having a conversation, and Carolyn's having a conversation with Senator Freeman, or I'm having a conversation with Chad, to be able to say, hey, they're investing $300 million in this. This 65 or 72, the $7 million reduction, that actually would have helped them there. Or, hey, they're not able to invest very much into it. So by doing this cut, this is really the impact that we're having. I think getting that information and having that ability to speak with Chad more about that, or legislators or whoever, would be helpful from my standpoint.
David would probably be the best to talk about that, because I know, representing the state probation officers, my personal county does a great job contributing to what our needs are and recognizing that. We have some, council members that are personally affected, by community supervision, and that's helped. Yeah. I also meet with and talk to chief probation officers whose county doesn't contribute anything to community corrections. Because in theory it's supposed to be self-funded. So I think you're going to get 92 different answers.
Sure, understand that, but that I'm just trying to frame what questions would I want answered in order to properly give the information to the people that I have to speak to around.
Community corrections and probation are funded differently, so remember that as well.
You want to add something to this,
Yeah,
David,
thanks,
please?
yeah, so obviously, always a finite amount of money at the local level. Property taxes have become a bad word in Indiana. We're struggling through Senate Bill 1, and it's not just community corrections and the criminal justice system that's seeing these reductions. It's really across the board. So counties are definitely trying to prioritize, and I know that some probation officers are coming to our next board meeting in November, I think, to talk about these issues and how we can partner up, try to find some efficiencies, and see how we can get through Senate Bill 1. It's created a lot of uncertainty for sure. So maybe counties are being a little bit more conservative in their budget estimates for 2026 because they really don't know what's the next step. And a lot of these changes are being phased in over 2 or 3 years. So definitely the goal of Senate Bill 1 was to reduce our revenue at the local level, and that's going to have an effect in many communities. Most of the rural communities will see the reduction in revenue. The more urban counties, large population, they may be able to make up some of the difference in property tax cuts through higher income taxes. So I just know it's a lot of transition. It's created a lot of angst within our membership, within those who provide local government services. So we're just working our way through it and trying our best we can to kind of get through to the other side, for lack of a better word. But it's a huge challenge, and as community corrections mentioned earlier, it's supposed to be self-funded, state-funded, self-funded. It does save us money from jail overcrowding. So if it wasn't there, we would be back at the General Assembly asking for probably more income tax capacity to build a bigger jail to house these people in, which in the long run is not not as efficient as the community correction system or probation. So maybe we just haven't done a great job of telling the story of how we're saving money through supervision versus incarceration. So maybe that's on us, and we'll work on trying to improve that storytelling for lack of better words.
Well, and then too, I just to add, Dan, David has told me several times, I think I read in your literature, in Indiana, it's about 70% of a county's budget goes to fund their criminal justice system. So we've got this really weird state-county mix. I live in, David does too, in Hendricks County now, which is resource-rich relative to other counties. So, I moved a large part because of the justice system, and everything that they were doing. The county I used to live in is resource-poor, right? And so it's just very disparate in the amount of resources they can put in. So, I mean, we'll have this discussion, but David, I hope that you...
If we want consistency across the state, for people to have equal services options for that, we have to move to a more state-funded model for criminal justice instead of a locally based service where assets the community has are dramatically different and property taxes are dramatically different and income taxes are dramatically different. So, I know our organization oftentimes advocates for the state to pick up more of these services so they can be consistent throughout the state for probation officer salaries, judicial salaries, judicial employee salaries, because it's such a difficult job process for a rural county to have the same services available as Hamilton County.
Well, and David, I had the opportunity, I'll say this in the context of this meeting, I've had an opportunity to speak to your board, and in my view, there would be probably, I think it's worth exploring, is there a sweet spot where a county could opt in to a sort of a state pay something that would be less than they're currently having to pay, and the state would realize a savings because they weren't duplicating the cost of a really expensive physical plant or something like that 91 times. I don't know that conversation has been had in a meaningful way, but I think given the belt tightening that needs to take place, it should be at least looked at. And so I maybe there's not a sweet spot. I have a hard time believing that because we, as I told you before, we duplicate the cost of our system 91 different times across the state. Ohio, Dearborn are consolidated, so I know how many counties there are, but that's an issue. We got to get through close out the meeting, so real quick, can I ask you to close us out with the announcement about the new? Yeah. Okay, Michelle.
Kick it to Michelle.
Yeah, Michelle, I'm sorry.
Thank you, Mr.
Again.
It's okay. Clear in our directions to you, sir. JREC's strategic plan has a provision on communication strategies and developing some more robust communication opportunities across all local JREC stakeholders from this team and from the local work group. So in authorizing that communications work group, I agree to serve as chair for that work group. So at this time, what we're asking for is for anyone from your membership group or your staff office who works with communication, someone on a communications team, a PIO, someone from your membership group who's got a passion for trying to communicate out information. So that way we can kind of help get resources out to folks in a more systemic way. We'd also be working very closely with the local JRAC work group because of substance and things that would be communicated. So our work group will kind of then report up to that one. So if you have staff folks who are interested, please email me and let me know who those folks are so we can try to get going on that. And there'll be more information to come.
Thanks, Michelle. Anything else to bring before the board?
Just real quickly,
yes,
if I
please,
could.
David.
Next week, hopefully, if you work around the courthouse, your courthouse will be lit up in green light. It's part of our national effort to recognize veterans and veteran service officers for the services they provide. So it's called Operation Greenlight. This is the 5th year for it. It's picking up momentum across the country. We actually have the permission to light up the Soldiers and Sailors Monument in green light on Thursday night. So we just want to make sure, and of course it leads up to Veterans Day on the 11th. So it's so that's sort of the culmination of the event. But if you're interested in the event, let me know. There's plenty of information on the National Association of Counties website, Operation Greenlight. Even a light bulb in the window, and maybe we'll generate the question of why is that there, and if you can just say it's for veterans and to make sure that they know there are services available to them through the veteran service officers.
Thanks for sharing that, David. That's anything else? Yeah, Steve, please.
I'd like to say that as a promotion, we have a mental health education symposium coming up on December 12th that many of you have attended before. We invite you to attend again. And one of the keynote presentations will be Sarah Sailors, who's the new DMHA director, and she'll be doing a fireside chat and willing and excited to answer everyone's questions. So if you're interested, please come.
Sarah's been a good partner, collaborative working in Indiana for a long time. That's great. Thank you for letting us know, Steve. Well, if there's nothing else to bring before the council, we will stand adjourned. I would let members know that our next meeting is December 19th, 2025, in this same location. And you'll receive an invitation from Riley for our 2026 JRAC meeting. So as always, thank you, friends. It's really an honor to be able to do this work with you, and happy Halloween. Thank you.